Alright, welcome back. As we have the final exam, and this is the last chapter and the last topic of this semester. So the final exam is just, I will upload the instruction again, but the final exam is scheduled from the June 30th and up to the July 1st. So I will give you the 48 hours, about 48 hours, as we had the last time for the midterm exam. And I'm still thinking about the format of exam, but that will be also very similar with the midterm exam, which means that you will only have the open access questions. Open-ended on the exam questions. Alright, so I will add more instructions on the website, and let's continue to the last topic of the semester. So these are some recent issues or the new topics of the population studies. We say that, so what kind of the new topics introduced in the population study in the United States? Maybe about 2 years ago, it could be the COVID-19. And after that, we might say the vaccination or the health inequality during the COVID-19 or aftermath of the COVID-19. So this is the demography, the famous and the best journal in the field of the studies of the population. And you can see that the topics of that one are the very recent issue. These are about the married woman and the mortality and the child of Mexico and the moderate exposure. So these are not that very new, or not only very new topics. But the COVID-19, we can avoid the mention about the COVID-19 and how did COVID-19 impact on your life course conditions or life choices. You might see many of the other topics or the conclusions. But anyway, after the COVID-19, there were many of the layoff conditions and the unemployment rates, and there were the differentiation by the gender. So based on the finding on the difference between the women's and the full-time employment rates, they were very different. So based on benefit, and this is one of my paper, and we found that based on the vaccine hesitancy, it means that those who the delays or the vaccination, and these were very strongly associated with their trust to the government, because the acceptance or the introduction of the vaccination was very highly driven by the very rapid, very urgent situation of the pandemic situation in the United States. So this is what we found on that. And the spatial demography, what you say that based on the region and based on the regional on the information, we see very more details. For example, the altitude and the impact of the disaster. Usually, in general, those who live in the higher altitude, and they are the wealthier, and they are usually the less likely to have the risks of the flood damages or others. Other than that, combined with the spatial the information, checking the population studies and finding association with the spatial conditions and their health conditions or the population outcomes, that these are also big topics about that. And I want to focus on the biodemography or the biomarkers of the population. So biomarkers are they're usually collected by the specimen on the blood test, and the biological demographic research and the cross between demography and epidemiology. So the using biomarkers are what you say the measurable and the quantifiable biological parameters, and these are very useful. So I will also add this link on the lecture slide again, but the bio levels. So sometimes not only based on our blood level and the sugar level, but also some scholars found that there even the mental health condition such as the depression and the anxiety, these can be measured by the blood test or some of the hormones contained in the blood. That was very surprising for me, because in most cases what I had as a common sense was usually the mental health were treated by the counselors or the psychiatrists. But based on the healthcare services and the new on the medical the articles, it was found that their blood level, their chemicals in the blood, that would be possible. Alright, so maybe you can skip this part because these are not relevant in our topic. But what should we care about that? So health condition of the America. Health of America is very, very important again. And the self-reported survey, is maybe you can some questions may ask your blood pressure, but sometimes the blood pressure is not very stable. And survey questions are sometimes, in most cases, I cannot say that sometimes, because most of the survey questions, they would ask you your health condition in those levels, or the categorical, very categorical on the questions. But usually the blood pressure and the diabetes, these are not measurable. They cannot be measured as those self-reported survey. And health conditions, sometimes in one day. So for example, after the exam, you might stay up at night and you might be very tired. So if you are asked about your health condition, you would say normal or sometimes very bad. But sometimes you'd have a very good health condition. But usually the survey question is asked one day out of 1 year. So the condition of the day is relevant with their schedule or their day of the condition. So this is very limited. However, some of the biological factors, these are collected by the medical professionals, and these are very directly relevant with their health condition, and also very rich information. So that's why the biomarkers are very important. So this is I generated from my previous course, and psychological and the biomarkers could be very useful, and very promising on the field of the study. So these are the benefits: provide the less reporting bias, and the valid data, and the causal link, and the exposure model. So there are some of the biomarkers, and we can also find things. So for example, this is based on the stress. There are the individual level and the macro level and the chronic stressors, and these are some of the pathways we can find the outcome of the morbidity and the mortality based on the stress level. But it's always impossible to make the causality, because on the chronic stressors and their morbidity disease, if they are counted in one time point, we are not sure that based on the health condition, because they have the bad health condition, they might be very stressed a lot. So we cannot guarantee that the stress is the cause of their sickness or the bad health condition. However, as you could see in the accumulated disadvantage in the life course theory in the previous video, if we have many time points and if we compare those various multiple time points, we can determine whether those kind of the health outcome was generated by other outcome. So that's why the longitudinal and the life course design and the biomarker by the blood test, that would be very useful. And also PTSD and those parts, they are also biomarkers are used, and enhance the range of mechanism. So not only based on the self-survey, but going into the micro and micro level, the biomarkers are very useful measure we can use as the very good measures at that. So what are the possible problems of biomarkers? So I mentioned that I emphasize a lot about the very good parts of the biomarkers. But you would say that the financial cost, usually these are based on the blood test, and as you had the blood test in the hospital, these are very expensive. And the biomarkers are very informative, but in case these are these are spread out to the others in the general public, and if some hackers get access to those confidential information, these are the violence of the privacy breach or others, and ethical issues, and the deterministic view. It means that the biology, so for example, like a phrenology argued that the shape of the head determines the characteristic. If they found that in their genetic root of the people, if they have some of the disabilities, or if they have some of the lineages of the serial killers, or kind of the the crime history, they could be discriminated because of their biological information. So we cannot say the biomarkers are not all, we cannot say the biological markers and biomarkers are good always, but there are some of the issues. We cannot say always good. Alright, so the some types of biomarkers, and we can see that maybe these are not very detailed informant, but anyway, those labels of the biomarkers are very, very useful. So one of my study, you also use the biomarker, in the CRP, which is the inflammation level by the blood test, and we found that so compared to controlling all, so the setting up all the conditions saying the higher levels of the inflammation in the blood measured by blood, these were associated with the higher risks of the having suicidal thoughts of the people. So again, those blood tests and the biomarkers are very useful, and maybe after the war the war between the Ukraine and the Russia, because many people died, and the citizens of the Ukraine and the Russians, they all suffer a lot. Maybe regardless of the condition, who are more blamed or more less blamed. But anyway, the war situation is very, very stressful. So after the 2023 and several years later, the studies after the impact, checking the impact of the Ukraine and the Russian war would be very prevalent in the population studies. Alright, so I rushed a lot because my purpose is not checking the details of this lecture, but also I wanted to introduce about the biomarkers and what are the positive and the negative aspects of the biomarkers. Alright, so thank you very much for your hard work during the summer semester. So thank you very much. I'm proud of your all hard work, and I'll try my best to complete the grading as soon as possible, and then I will post the instruction of the final exam very soon. Alright, thank you very much, and good luck in your final exam. Thank you.